Welcome to Every Animal Has an Owner, a mostly large animal podcast for veterinarians and the people that depend on them.
My name is Dr. Brian Huseman. I'm a veterinarian by training, and I've spent most of my career, most of it in the animal health industry. I've worked for 7 animal health companies in the R&D and regulatory and animal care groups. And today I'm going to be talking about horn flies, and they're of great importance to us in the cattle industry because they're one of the most significant production loss items that we can have. A study done back in the 90s estimated that the monetary damage to horn flies for the U.S. livestock industry was around $876 million at that point in time. And if you put that into today's terms, it's at least $1.75 billion annually in production losses and the cost of insecticides and treatment plans and that type of thing. The horn fly itself is a interesting parasite. The life cycle is about 9 to 10 days, and the adult female will lay roughly 150 to 300 eggs in her lifespan. And they feed continuously. The males will feed up to 20 times a day, and the females will feed up to 40 times a day. And so they spend a lot of time irritating the cattle that they're feeding on. All the animal wants to do is stand around, swish their tail, stand in water to try and get them off of them, rather than spending time grazing. And the horn fly females will then lay eggs in the manure piles around the cattle, and some of the literature that you read about will say that they are actually laying eggs before all the droppings even hit the ground. The highest populations of horn flies for most of the U.S. occur between April and October, and since they can have 10-day life cycles, that's up to 19 to 20, 25 life cycles in a season. So what Medgene is doing now is using a product from the fly's salivary gland that they need to produce anticoagulant and to get their blood meals as they feed, and that product is thrombostatin. So we're making a product so the animals themselves will produce antithrombostatin, and with that, then when the fly goes to feed, they are not able to anticoagulate the site, and therefore they can't complete their blood meal. As an analogy to this, we've all probably had a fruit shake at some point in time, and as you're sucking through the straw, that's what the fly is doing with the anticoagulant. But if you get a piece of fruit at the end of that, it plugs the straw and they're no longer able to suck it through. And so when these flies have a blood meal that's coagulating in their mouth parts, they're no longer able to feed. Blood is an important portion for the fly's reproductive cycle, and it since they can't have a complete feed, the females are not able to complete their reproductive cycle and will lay less eggs, and as such, you're going to decrease the load over the course of the season. In some studies, they found up to a 60 to 65, 70% reduction. It's something that we haven't had to date. The more animals that have antibodies in them, the better the control will be as far as reducing the fly load in the environment.